Right there. Meeting of the Dundee Township Mental Health Board is called to order of April the 10th, 2025. President of the Mental Health Board presiding. Please call the roll.
Adame.
Present.
Auger.
Present.
Connell. Corrins.
Present.
Kempf. Thrower.
Present.
Avalar.
Present. And we have a quorum.
You have a quorum.
Thank you. All rise for the Pledge of Allegiance. I'd like to ask the Honorable Clerk-elect Elizabeth Clark to lead us in the pledge.
I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amen. Chair will entertain a motion to approve the agenda as presented.
I'll move.
Moved by Auger.
I'll second.
Seconded by Thrower. Discussion. Hearing none, all those in favor, please signify by saying aye.
Aye.
All opposed, same sign. The agenda is approved. Chair will entertain a motion to approve the meeting minutes of the regular meeting of March the 13th, 2025.
I'll move.
Moved by Auger, seconded by Adame. Discussion. Mr. Auger.
Yeah, I'd like to see the minutes updated to include the Act Dundee Township Mental Health YouTube link so that when people read the minutes, we can refer them there.
Okay.
Okay. So we have a motion to approve, so it's now amended minutes. Any other discussion on the minutes? There are none. Okay. The motion on the floor is to approve the minutes with the recommended change. All in favor, please signify by saying aye.
Aye.
All opposed, same sign. Amended minutes are approved. Chair will entertain public comment. Is there anyone wishing to address the Mental Health Board this evening? Seeing none, we will move on to the coordinator's report. Mr. Sanchez.
Okay. All right, let me try and blow this up a little bit. I did not get a chance to send this out before the meeting because sometimes Murphy's Law kicks in, and today seems to be one of those days, but this is slightly different than the one that was sent out the other day. So I'll just go through this. Police social worker, there really isn't an update yet. Now that the election has passed, I'll have more opportunities to work with village officials and the police department to see if there's anything that we're able to come up with either as an alternative or as a new opportunity for expanding the program. So as soon as there's anything to update you on with this, I will definitely let you know right away. The ACMI conference last week, another good conference down in Springfield. The focus was on legislative activities, so maybe not always the most relevant for a lot of the work that we do, but it's obviously a big part of the context that this board operates within. There were good presentations on what lobbying is, the importance of developing relationships, and I think the new lobbyist that ACMI has is really strong. She's very her relationships run very deep down there across aisles, and seemed very knowledgeable, very good team. So I think we had a good lobbying firm before, but I think we've increased that capacity quite a bit. An interesting connection was Ryan Rollinson, the Chief of Staff for the Division of Mental Health at Illinois Department of Human Services, and he essentially gave an open invitation to all boards to connect and to see if there are any opportunities for collaboration, if there's any data or information or things that they can share with us. So we'll be following up with them and seeing how our organization can connect with theirs. And as always, conferences are a great way to network, especially for staff to share, connect, trade war stories and successes and failures and things like that. So some of my time is spent down there talking to others. I got a lot of FaceTime with the president of ACMI, Jason Holcomb, and just very good, kind of staff to staff level information. And then
just a reference, Jason Holcomb, the president of ACMI, is also the executive director of the Winnebago County Mental Health Board. So fairly close neighbor, and they've got the unique situation of being the first mental health board to fund their programs with a sales tax. And that was, referendum happened, it just passed here on April 1st for the county on a different purpose. But I just want to call out Mr. Holcomb. He's a very great resource. He's always been terrific to work with. So
yeah, great team they have over there. And then the recordings are, I believe they're available now, so I'll be making sure to send the link out to all board members so that you can follow up on that and see what was talked about if you wish. Pivotal presentation, I'm not going to read all of these, but I did send it to you so that you know where they're at so far. Lindsay Keisman, she wasn't able to come tonight. Did you have a question?
Finish up. I've
All
got a
right,
couple.
she wasn't able to come tonight. Her schedule conflicts a lot with our meetings. She tries when she can, but this is the updated list that she has right now and is working. As you can see at the bottom, there's a few organizations that she's working on setting up some more presentations with.
Okay, Mr. Auger.
2 questions. Gale Borden Library, that's in Elgin. That's not in Dundee Township. Why are they having it there? Wouldn't we want to have something within Dundee Township for the residents?
Yeah, I'll follow up with her. My understanding was that there are Dundee Township residents that go to programming at Gale Borden Library. Our own library has a lot of programming, but Gale Borden's is more robust, so they do attract an audience from Dundee Township quite a bit. But I can verify that with her and make sure that it's within our scope.
Yeah, I guess I just don't see that as being, we're trying to locate services closer to the center of our, residents, and that seems to be taking our residents further away. So I'd like to see something closer in one of our, Fox River library if necessary.
Or maybe one in each branch.
Yeah.
The
one
main
of each.
branch and the Randall.
Yeah, all right, I'll follow up with her on that.
And then the Evolve Chiropractic, they have a number of offices. I didn't see any that were in Dundee Township.
There's the one on Algonquin. That was actually my referral to them.
Okay, so that there is one that?
Yeah, it's
that-
in the Algonquin Commons Shopping Center.
Oh, really? Okay.
Yeah.
I just looked on their page and it didn't jump
Yeah.
out at me that they had one.
I think it's only a year old now.
Okay.
Yeah.
Okay.
All right.
But, and it's on the Dundee side of the line, so
Perfect.
it's
Yeah.
in the township.
Any other questions on the pivotal update?
I think it's fine that they're meeting at Gale Borden. I know some of our Elgin residents, when I worked in Elgin, were from Carpentersville. And so I also think it's a different demographic there, Spanish speaking, so if they have the opportunity to provide like interpretation services or translated version, I think they would attract a different population also. So it sounds like they are focusing on Fox River Valley libraries, the majority of their presentation, so it's only one in Gale Borden.
Okay, well, Mr. Sanchez, you'll get the clarification from Ms. Kyman.
Yeah,
And,
I'll ask her what the rationale was for that one.
good.
Okay. I met with the Kane County Health Department staff, Kim Peterson primarily, also Michael Isaacson and Liz, I cannot remember her last name at the moment, but it was a very good meeting. We discussed, the primary focus originally was a needs assessment, but then in speaking with President Avalar, he requested we dig a little deeper into some of the data that they have, primary and secondary sources, and how we can better utilize those. With the needs assessment, there were, we kind of jumped around a lot, but there were definitely some areas of opportunity that we identified through conversation. One of them being working towards enhancing the questions and developing standard questions that they use for their own, like the community mental health assessment, but providing suggested, maybe not template, but standardized questions that mental health boards could use that might help us get more specificity, might help us find more of what we're looking for. So the next time we want to do a needs assessment, the idea being we discuss this with them and see what they have and how they might be able to help us craft our needs assessment requirements the next time that we do that. Some of these potential areas of opportunity, just based on what the findings were of the needs assessment and things that we haven't already explored, anxiety and depression groups, especially ones offered in Spanish, especially, obviously in the Carpentersville area. Parent Cafe is a group that already exists in Kane County, and they have little branches throughout. So they're gonna talk to them and see if there's something. There is one of their members that is in Carpentersville, but they're gonna see if they can create a group up here. It's for parents, so it's not all mental health related, but there is a lot of that component in there, and they can also focus more on these topics as well. Funding for at-home ramps and adaptive medical devices for adults with disabilities. Obviously, that's a topic for discussion on the Round 2 grant program, but that is something, we have these residents who are on the PUNS list, and they may wait as long as 2 to 4 years on average until the federal and state funding kicks in to give them what they need as adults with disabilities going forward. And the numbers are enormous. They're well beyond our funding capacity, even if we maxed out our levy. So other things like ramps outside of their homes, it's something you wouldn't think of. You would think, oh yeah, people get those. No, there is actually quite a need for things like that and other adaptive devices that help them live a better life. Seniors in isolation, the mental health impacts of that. And then we talked about Alice households, and it is a difficult one to tackle. So there wasn't any concrete ideas that came of that. It was more just like an ongoing conversation. And with the changing landscape in federal funding, we may see even more people that fall into this category, just as we may see more people that are going to be requiring, services through things like Medicaid. So it's kind of something that they're monitoring, they're aware of, and they're always looking for ways to address that population more. And then as far as data sourcing, I gave them Mark's specific requests. We talked a lot about what they can and can't do, what they do and don't have, but also looking toward the future for their next assessment and really beefing up the details, the granular level details of the information that they gather, so that all the mental health boards in Kane County eventually can have very specific statistics for their area. But they're going to be sending along things that they have that are more updated, up to date. And I know, Mark, you'll be included in that, I think, directly. And then another idea was convening a meeting like once a year of all the mental health boards in Kane County. We have the Inc. board down south. There's about 7 different mental health boards, but then you have, I believe, Geneva and St. Charles. The cities have their own, and then Elgin and Dundee Township have their own. And they're not all talking. They're at different levels of maturity. And so the idea being, if we could at least get together once a year, even just on the staff level, to discuss, what's working, what's not working, some of the things that, the ideas that could be shared, and just kind of, share that information. But also there is a behavioral health advisory board that Kane County utilizes, that the health department utilizes. And the Inc. board already has their staff attending those. So I suggested, well, why not have all mental health board have representation there? And they thought that was a good idea as well. So they'll be following up with us on that to see, because again, that's another avenue where we might be able to discover some useful ideas, things that we can bring back for our area, since we don't have a county-wide mental health board. Some administrative items, meeting recording backup. We do have an external hard drive now, so this is probably not even worth mentioning, but it's just something that I run into, is having space to store these things. So long term, we'll probably use SharePoint for these video files, but for right now, we do have these things being backed up so that I can use my laptop without it having no space available on it.
Just a minute. Member Auger.
And again, what's the forecast for when we're going to have SharePoint up and running so we can begin putting all of the various documents that we have under configuration control and sharing them with the rest of the board members?
The goal is by the end of next week, it'll be usable for board members. It'll have everything that you all need and we'll be looking for, and then setting up access for everybody. So everybody will have a unique login credential. I'll have to work with our tech group to set all of that up, and then work with each of you individually to make sure you're able to access it. If there are any problems, we can troubleshoot it. But once you're in, you'll be able to access it like anything else that you have, that's password protected. And so it'll be a very good resource for you guys, because we do have the members only section of the website, but it's clunky and it's not secure in the way that we would like it to be. So SharePoint, I think, is going to be a very good, useful tool for us. Legal is looking into transitioning the administrative coordinator position to W-2, and just double checking on the officer elections to verify whether we do or do not need to do an officer election in June. Website update coming soon. Not a huge update, but I need to go in there and spend some time and really beef up some of the links, add some things in there, and just kind of, it's something that should be done every once in a while anyway. It's just update that.
Okay, Member Auger.
Yeah. I keep asking this, but can we do more to offload some of that to a contractor? We have a company that Revise, that is, contracted to support our website? I mean, are these little things like adding minutes, or are you talking about redesigning pages?
No, I'm adding links, things like that. So nothing that we would need to contract out, but
Okay.
it's just something I want to spend some focused time on and.
Okay.
Just clean.
I just want to make
Yeah,
sure
clean
that
it up
we're,
and-
utilizing additional resources that have expertise when it's appropriate.
Okay. Either Member Thrower or Member Corrins, one of y'all say something?
Just
Go ahead.
again, for what it's worth, I do have some concerns about SharePoint because it's almost as like we're adding staff now. So just remember, once a document is created, whether it's digital or paper, that is foilable. So if a board member gets in there, accidentally deletes something, I'm just worried about the transparency. And again, I do question the need of like all the board members. Just in my experience, it's like staff has access to drives and SharePoint and stuff in the cloud, and then they share that obviously with board members. But I'm talking versions. So if you have 10 versions of something, like you got to make sure you have all that. So I understand wanting to share the stuff, but it's just, I feel like it's a different philosophy to have every board member has a login is in the guts of everything.
So that's not how it will be.
Okay.
Board members will have read-only access.
Okay.
And if there are board members that, if we're going to be involved in, amending documents, we're drafting things together, we can create that access in specific folders for board
Okay.
members.
All right.
So it wouldn't be like all files available and
Yeah,
everything.
because I just know with
Yeah.
staff, like how many files we have. And
Yeah.
it's like, oh, now we're adding all the
Yeah.
board into that. So, okay.
Mhm.
Just like
Just
most,
wanna make sure it's controlled.
Yeah,
Yes.
absolutely.
it definitely has to be controlled, and certainly with most online analytical processing, OLAP, and you go back to your project management world, program management world, Member Auger, there has to be the strategy of, okay, it's administered, it's got a central point of contact of who's administering it. Yes, I mean, board members should have no more than read-only access.
Mhm.
Anything that we need updated, we work it through you and/or through an action of the board, but again, through our coordinator and/or
Okay.
any appropriate staff.
Okay.
Yeah.
That make sense?
No,
Member Corns?
Okay.
No, we use SharePoint at my job, and that was the same thing. I was like, okay, so someone moves
Yeah,
something
that's-
into the wrong folder.
Yeah.
And it's like,
Read-only.
because it happens, I mean, I've seen
Yeah.
it, so.
We don't
I'm
take
like,
that
it's a good
chance.
point,
I know.
but-
I'm a,
With Kane County, when we were developing our ARPA program, we did use SharePoint at one time, and we created specific folders for people to input invoices and things like that. They didn't have access to anything else. All they
Okay.
saw was
All right.
one folder, and that was it.
Yeah.
So it's basically the old sandbox strategy of users, if they need to sandbox something, and then when it's final, then the administrator would then put it into the appropriate place.
Yeah.
Right.
But the
Yeah.
sandbox is not auditable, it's just, as it is a sandbox.
Mhm.
It's like a workspace. Okay, continue.
And that was my next point. SharePoint, I did meet with Clarity Tech to just go over at least their knowledge base. I think I'll be able to do everything that we need to do without having to outsource to a consultant. There are functionalities that I find interesting with SharePoint that was beyond the scope of Clarity Tech. Whether we want to go in that direction in the future or not, we can discuss that when we get to that point, and that would be when we bring a consultant in. But for right now, everything we covered and my own knowledge of SharePoint, we'll be able to utilize it for our needs at the very least. Anything beyond that, we can outsource. Found it, hasn't responded, which is kind of surprising because I did reach out to them before.
Go ahead. Member Auger.
I can cover that during the board updates. I have been in contact with them. I do have information
Okay.
that I can share when we get to that point.
Excellent.
Yeah, because I had reached out before and somebody had responded, and then I kind of put that on hold, and then I followed up again and went cold, so, okay. Upcoming events, we just had the annual town meeting this past Tuesday. Mr. Avalar presented for the Mental Health Board. The roundtable meeting is April 23rd. I forgot to put it's at 1 p.m. So that'll be good. We haven't had one in a few months. And then Meadowdale Elementary's resource fair for the May 15th date. It was going to be just at Meadowdale, and I was notified the other day that they're now working with, I think, 3 other schools. There's a lot of interest, and it's going to be hosted at Lakewood Elementary, which has a bigger gymnasium, I believe. So it's going to be a much more sizable crowd, and I think about 200 people rolled through there last year just for Meadowdale. So I'm expecting quite a lot more than that, and we may go through all of the push-pull balls, push-pot balls that we have. So those were pretty popular at the St. Patty's Day parade as well.
Because it's green, I think, too, but still, it
Yeah.
was fun throwing these.
And I believe, this is for later discussion. We can come back to that if you'd like, or if you want me to just cover. This is.
Let's just cover it at the appropriate
Okay, yeah,
time of
because
the
it's for
agenda.
the one-year plan. Other than that, that is it. I did include these slides, but I'm going to wait until the one-year plan is approved to start to populate all this after we get feedback tonight. So if there's any other questions.
Okay, any questions from the board for Mr. Sanchez on his update? Right? No. All right. One request, go back to the, oh, you already took it down. If you go up to when you had the meeting with the county. Okay. Starting to have meetings with other mental health boards. I thought this was already going on with the more established boards. Is that not true, or is that? I would think like the Inc. Alliance, Mental Health Alliances, has already been having these meetings and these data sharing. Are they doing anything with the data that the county has?
Well, I do believe that they do use the community mental health assessment from the county.
Okay.
They didn't specify that they follow up in between those health assessments to obtain data for their own
Okay.
levying purposes.
And my understanding is the data under the data sourcing, the data is updated periodically. It's not just once every 3 years and it's done. It's updated either monthly or quarterly. Is that correct?
That's my understanding.
And that's the kind of information that we're hoping to be able to drill down for Dundee Township, provided it has the granularity. And I know we'll see the more detailed data charts on that
Yeah,
later.
so actually I forgot to add the bullet point. What they're working toward is creating a kind of, potentially a monthly report that will give the more specific localized data points that they do have, but it's taking what they have and putting that into a usable, readable format is something that they're working on. That was the staff person, Liz, who was there. That's her job right now. So that's something that they're already working on even before we knew we were going to be having this conversation with them. And they didn't say when that would start to roll out, but they're looking forward to having it soon. So it'll be a more usable form.
Okay. I definitely would applaud, and I guess I'm most surprised that this is happening, that this isn't already going on with the more established boards with the 7 townships in the south plus Geneva and St. Charles, but better late than never as far as collaborating, because, I mean, we have to have similar challenges for our respective areas as far as how do we ID early on with the information and the metrics that come through Kane County, and how might we get there faster. Now, also, didn't Executive Director Isaacson and his staff have a similar presentation with Elgin Township Mental Health Board last month?
I don't know, that didn't come up, so
Okay.
I would have to ask that.
Okay, please do it as a follow-up. I think it was on one of the task lists of that, because if, I'm curious what they presented. If it was just a generic, then we'll see through that pretty quickly.
360.
Excuse me?
Oh, it was Behavioral Health 360.
360 platform that they rolled out. They came and have a presentation about that.
Okay, so that was the subject,
Yeah.
it wasn't the data. All right. I knew they had some presentation, and it happened to be the same night as the March Township meeting, so we couldn't attend,
Yeah,
so.
and that is something they're willing to present here if the board would like.
If you can just get a copy of the deck, I'd just like to see the deck first, and then we
Okay.
can ask them later if we feel something we have an opportunity to use. Okay. We'll come back, we'll take the rest of this offline, but thank you, very thorough report. All right. Chair will now entertain a motion to approve the list of bills of the April financial reports as amended.
I'll move.
Moved by Augur.
I'll second.
Second, was that Corns?
Thrower.
It was Thrower, okay. All right, discussion, and begin with the amendment.
Yeah, so there was an error on this. The first Family Service Association invoice, I think it had the amount from last month, and somehow I missed that. So it now reflects the correct amount with the corrected total monthly expenses amount at the bottom. You'll notice this invoice is from October 2024, which was quite a few months ago. They notified me the other day they were closing out with their accounting and noticed the August invoice hadn't been paid, so I looked into it, realized that that was true, and the email that they sent to us got lost in the junk folder somehow. I never received it, I never saw it. So that's what happened there. But they were okay with it. They said, actually, this does happen more often than you would think. So luckily, all is well there. But that's why you're seeing, it's not an error. That is from August of 2024.
Okay, so let's clarify, so it's definitely August, not October, and the amount of that was $8,933.19 as it was in our packet?
Yeah. What was
I can barely see that.
Is
so
it
I need
19 or 29?
29.
Yeah.
29. And then the new total that we're, for the amended report is 37,985.85?
95.
95, okay, I need new glasses, sorry. All right, anything else on the,
Not much of note. We have ABC Counseling as a first invoice from another, from them. And some invoices have come in since this report that will be on next month's agenda. Obviously, the reimbursement for the ACMI travel. And then Ride and Cane, it should have been in the for approval category, so I apologize that it's in the pre-approved expenses. I mean, the allocation is already approved, but this is similar to our other grant program invoices and should be in the for approval. So I would just ask an amendment be made to reflect the new totals, the new amounts, and to reflect that Ride and Cane is actually in the for approval, just for technical sake.
okay, so we already got the corrections for FSA and the new total, so we'll add as part of the amended, as the motion reflects, to add Ride and Cane to the for approval section there. All right. Any questions for Mr. Sanchez? Member Thrower?
Because FSAs are for fiscal year '25, which we've closed out, are we gonna have the accountant just?
I'm going to ask them if they can put it back into.
Perfect.
Yeah.
Thank you.
Mhm.
Okay. Any other questions for Mr. Sanchez? All right, something I'll mention to the board, as you see a hotel billing for me, best laid plans. The hotel credit I had is the same hotel that was shut down for overnight stays in Springfield, and I think they're still shut down, so I had to quickly use the conference hotel, and that's why you have to see a hotel expense. I know I had mentioned I was going to use a credit. Murphy's Law prevented that from happening, and we saw the service master vehicles outside the Wyndham across the street, and that's a very real emergency when that vandalism, and then it was rated not fit for occupancy, so. A question?
Yeah, apparently the elevator cables were cut and there was flooding in the basement. So it wasn't just, oh, we've got bed bugs or something. It was, I mean, there's about 20, 25 service master vans around the building. I mean, just probably working 24 hours.
Fortunately, I saw the alert.
Crazy.
I saw the alert that Friday when they shut it down, and that's when I quickly was making the other reservation. So I had to react. Again,
Yeah.
Murphy's Law.
And there was no early check-in at our hotel because they had all those people coming over.
Fun stuff
It was interesting.
in the
Never hear a
Capitol.
hotel being shut down.
Okay, if there's no other questions or comments on, Mr.
So
Auger.
just kind of going through, so all of the other billing, like I'm still looking at the old financial report, but under the, let's see, page 8 of it, where you have the family services, you have a 23,981. Is that the same
Yeah,
one?
that's all gonna have to be amended as well as the,
Okay, so
the
that's all
year-end.
covered.
Yeah, the year-end closeout as well
Perfect.
will be reflected to have this $8,000 item in it as well.
Okay, very good.
Okay, and of course, got to keep the auditors happy on that one too,
Yeah.
so. Okay, any other questions or discussion? Seeing none, please call the roll.
Adame,
Yes.
Auger,
Yes.
Corns,
Yes.
Thrower,
Yes.
Avalar.
Yes. The amended report is approved. Chair will entertain a motion to approve the one-year plan for fiscal year 2026. Moved by Adame,
I'll second.
seconded by Thrower. Discussion, Mr. Sanchez.
Okay, I included the language, here, let me pull it up, sorry. Oh, this was just mine, I am sorry. Forgetting which documents are in what order.
There you
So
go.
there we go. I included all of the language revisions that were discussed last month. And there were just a couple instances, President Avalar and I went over this, where we just put in somewhat of a timeline, time limit for some of these items. just to have a little bit more of that, SMART goal, quote unquote, specificity. So instead of just review and revise the communications plan, let's have it done by September, things like that. But there were only 1 or 2 of those additions, identifying further service gaps by July, conducting the survey of residents. There was one recommended addition from President Avalar here at the bottom, goal 5, to integrate county level data from primary and secondary sources. So if you would like to include that, you can make your motion second to include that as amended, or just make a separate motion to amend, however you prefer.
Member Adame, it was your motion. Would you like to make that amendment a motion?
I can, yeah.
Okay.
Yes,
Member
that's
Throw?
fine.
Okay, so we're covered. Thank you.
All right, discussion?
Are you, before, are you
Yeah, I
through?
don't have anything else. No.
Member Auger?
Okay, going back to that last item, can you explain what that's gonna look like? Integrate current level data from primary and secondary sources?
As
Where is
the
that gonna
county
be?
level data.
Yeah, but where are we gonna,
So that
where's
gets
it gonna
back
be
to,
included?
Right, that gets back to what we were just discussing with my conversation with the health department. So that report that they're working on, that they're developing,
Okay,
when they start to send that out, we receive those, then we could use that in our long-term planning that can help inform, some of the programming that the board goes after.
I
Okay,
think
so
where
it's-
Member Auger is going is, where is all this data going to be stored? Is that where you're kind of
well,
headed?
no, as it stated right there, it just says integrate county level data from primary and secondary. Well, integrate it where, for what? So what you're saying is integrate county level data from Kane County so that we can use it in our planning or something to that effect. I guess if you could clarify that, that would.
Okay, yeah, I can add a little clarifying clause there.
From a best practices standpoint, I foresee this being more of a data mart, because the county's the source of all this primary and secondary data. Obviously, it's marted because we want Dundee Township specific
Okay,
data.
okay,
We're not going to be carrying redundancies. We don't need to carry information about Elgin or St. Charles or anything like that.
right,
So that's a part of, that's why this is not going to be, we're not going to be taking a full copy or a full data dump
right,
and tax our resources. We will use what we need,
right,
and that's Dundee Township specific.
okay. So I'm,
So like, obviously.
So I can add maybe to inform future planning.
yeah,
Yeah.
that's it, I mean.
Yeah, just to
How
make
are
it
we
more
gonna
clear.
integrate it?
Yeah,
Okay.
Right.
because otherwise it's like, okay, well, how do we know we did it? What,
Yeah,
Right.
yeah,
Makes sense.
okay. Anything else on this?
Hey, and many more questions or comments from the board? All right, I credit you, Mr. Sanchez, for integrating this, and again, this is showing a step of maturity where we're very, very early in the fiscal year. We are setting our one-year plan. This is what we'll be tracking to between now and the end of February, so thank you, Mr. Sanchez. And anything else? No discussion? All right. If no other discussion, please call the roll.
Adame?
Yes.
Auger?
approve,
Correns?
Yes.
Thrower?
Yes.
Adler?
Yes, the one-year plan is approved. We'll get this, please post this as soon as possible on the website.
Okay.
Discussion of resident survey vendor options. This is definitely in our packet, and Mr. Auger, I think this is your show.
yeah. Okay, so earlier or late last year, we had discussed the possibility of conducting a follow-on survey to our.
Do you want to you want to scroll, or do you want
Yeah,
to just
I
follow
can,
along?
screw. Thank you. Doing a follow-on survey to understand how we have improved in terms of the residents' perceptions of the mental health board and the services that we provide. So if we go back to some of the findings from the needs assessment, there were a variety of points that were made that it was thought that things were hard or very hard to get information about the services, or it would be very difficult to get screening. And, overall, the respondents thought it was hard to get mental health services within Dundee Township. Some of the things, obviously, that we do are fund agencies to provide those services, but we also have a website presence, a social media presence, now we have a YouTube presence, and we should be doing something to understand how those, devices are impacting the perceptions of the community. So the idea is go out, have another survey done. It gives us the opportunity to learn about what the residents are thinking, but it also gives us an opportunity to promote ourselves to the residents that, hey, we're out there, go take a look, tell us what you think. There may still be residents that don't realize that we even exist. To come up with some, at the last, I should say, going back to the meeting at the end of last year, it was thought that it was too early. It was also thought that we did not have enough quote sources to find out how much it might really cost. So I went out and got some additional information. Let's see if I can make this a little bigger. Joe's not here, so he can probably, he's the one that has a hard time reading. But what I did was I went out and contacted a number of different agencies that would provide these type of services. Our needs assessment was done by NIU. Unfortunately, NIU's government studies program is being terminated at the end of this year.
That's shocker.
So that one is off the table. Mindy Schneiderman, who was the director that actually conducted the report for us, will be retiring as well, and that will allow her to go ahead and do it. She has proposed doing a similar type of survey. It would cost $8,000. 3,000 residents would be targeted with the goal of having 750. Metopio came back with a quote of $7,500 for 2,000 with 500 respondents. They are the ones that did the needs assessment at the county level. So that's important to note. Tri-West was another company that we looked at for the needs assessment. Needless to say, I think their quote was, "We really don't want to do the job." So that one I tend to think is off the table.
Well, Mr. Sanchez, you have
I
a
was going to
comment?
say, but is that for the whole township, or did they not say?
I gave them the questions. I gave them the
Okay.
the township. So yeah, that came as a bit of a shocker.
Okay.
There are a couple of other opportunities as well. One is called Interaction Metrics. They were very eager to work with us. However, I could not get a complete cost from them because they were sourcing how much a resident list would cost. I don't know how much that is. I actually made an inquiry of my own. Then there was Beyond Feedback, another more national type of agency that does surveys. They came back at $26,790. One that I was hoping to get a response from was ECC. It probably would be in our best interest to try and partner with some educational entities in the area to see if we can both utilize their expertise as well as perhaps even collaborate on some things. They do have, I believe, a social worker program there, but they did not indicate that they were geared up to support any type of a survey effort. So something to think about in the future. And then the last one was if we want to spin our own. I did a kind of a cost estimate of how many hours I thought it would take, utilizing the township information or township list of newsletter recipients, and that would be about $2,800. But that would mean that we, or in this case, Coordinator Sanchez would be taking on that. And it was probably somewhere, I have a slide later on, it was a significant number of hours. My recommendation would be that we go and outsource this. I think that provides a couple of benefits. One is that we can offload this from the administrative coordinator so that he can work on other things that are important, like the grants that we're going to be coming up with. I think there's also a little bit of separation too. One of the concerns that we might encounter with ourselves asking township residents to fill out the survey is there may not be that, there may be too much transparency, and people may not want to do that. So if we go through a third party, that may provide a little bit more separation and make residents more open to providing their comments. So then we're not, I didn't bring this up for vote because I think people may want to take a look at the quotes that I had sent out, but my leanings would probably be towards either having Mindy Schneiderman perform it since she has experience with us, but I think the other one that's a contender is Metopio. It sounds like we're trying to do more to collaborate with the county, and utilizing them would kind of fall in line with that. And they would potentially be a source for doing future needs assessments for us as well.
Okay. And you have some additional slides?
Yeah,
here, or
so
just-
the other slides, just I had put together a demo link if people want to look at that with some charts. And then I guess I did not include the cost breakdown for the township. But I would tend to lean towards one of the first two options myself, but let people take a look at that. And I guess, Mr. President, I'd probably want to bring it up for a vote at the next meeting.
Okay, so we'll put this as an action item for the May 8th. And immediate comment or feedback from the board. Member Thrower.
Feel so dumb commenting, but for what it's worth, I've worked with Dr. Schneiderman, City of Wheaton, and here, and she's excellent, and we have that comfort level with Metopio for King County, so totally agree with Ray on those two. And again, I will not be here to do the Dundee Township newsletter, but hopefully it will continue and certainly promote the link for the survey in the newsletter at the very least, so.
Yep.
Okay. Anyone else? Member Auger, I think you were reading my mind when it came to Metopio, certainly, because that could be a scary proposition, but at least we're on the same page when it comes to how might we complement that with now our recently amended long-term goal of setting up that infrastructure. I mean, obviously, there's two different tracks, but as we define what our infrastructure will be for the data, because clearly what Metopio is going to do is primary research for us, is what we're asking. And then storing that information and using it as a basis of comparison for the future is, I recognize that right you have here is the immediate cost of the needs of the survey itself, but not including other things. But if it turns into, morphs into something, if the board decides to want to potentially take advantage of the opportunity of not only the primary survey, but also the data that could complement it, maybe this might give us a head start on utilizing what the county has already been collecting and is collecting on a regular basis, and then have it updated on a regular basis, so it's not just a one and done survey. It's updated, it's provisioned every 2 to 3 months, and help us get a better gauge of what's going on in the township, depending on what that data is, and we'll get the full list. But they could we have an opportunity to complement it between now and May 8th. Maybe we'll flesh that out a little bit before the vote. Very good job. Any other questions?
And just, I had something, just on Metopio, did they only give a quote for 2,000 residents? Or was it, okay.
Yeah, so the Mindy Schneiderman provided several options. The 8,000 seemed to be the more cost-effective one. There was a broader one that was going to be about 11.5.
Mm-hmm.
But for what we're doing, I don't think we need the demographic data like we had for our needs assessment. We're looking for a general, what's the pulse of the community? Mm-hmm. Are we making some progress on the points that they pointed? And like I said, just getting our name out there so people know this is a resource that they can go use.
Mm-hmm. Okay, yeah, I was just curious if they were able to scale up to that 3,000.
They probably could.
Yeah.
That was not a question that was asked of them. Mindy Schneiderman believed that 3,000 was needed to, I guess, provide higher statistical accuracy.
Okay, good. Any other comments or questions? Very good job, Ray. Thank you. And this will have an action item for the May 8th meeting concerning which way we're going to go. Chair will entertain a motion to approve the allocation for grant year 2025 Round 2 grant award in an amount not to exceed $200,000.
I'll move.
Moved by Augur. Second by Corrins. Discussion, Mr. Sanchez?
Yeah, this is just an allocation resolution to just specify and state that you're interested in pursuing this at the amount not to exceed 200,000. It's pretty straightforward, similar to what we did with Ride and Cane.
Okay. Can you walk through the key dates, please?
That would be on the next item, the NOFO. This is just to approve the
Oh, it's the
overall
okay, I'm sorry.
allocation.
We divided it. All right.
Yeah.
Any questions or discussion on the motion on the table of the allocation? All right, hearing none, please call the roll.
Adame.
Yes.
Augur.
Approve.
Corrins.
Yes.
Thrower.
Yes.
Avalar.
Yes. The allocation is approved. Chair will entertain a motion for the NOFO for grant year 2025 Round 2 and to authorize the president and staff to amend grant documents.
I'll move.
Moved by Adame,
I'll second.
second by Augur. Discussion. Now we go to the key dates.
Yeah, so this is the NOFO, the Notice of Funding Opportunity. It's pretty much the same document that we used for the round of grants that are currently underway, just updated with the specific categories and some of the dates and amounts reflecting those changes. So some of the behind-the-scenes discussion is reflected here in what you guys would want. So the first one being the tentative funding timeline. Actually, I think both of the questions that really are needing to be determined tonight revolve around this. So I put here is a July to June funding timeline. That is the timeline most service providers are used to. That's how what the state operates. And when I was talking with the health department the other day, they iterated that same thing, and I've talked to other service providers that everyone's just used to that. Everyone's fiscal year doesn't necessarily line up with July and June, but they're used to that funding cycle being on that timeline. But also because, our current program started January, goes to December, and, this is a round 2, it's kind of like, oh, well, let's start it halfway in the year. But then the idea, well, can we go retroactive? We can, certainly. Although with these funding categories, there may not be any programming currently underway that an agency would be able to have reimbursements for. So with FSA, they're always doing the types of clinical services that they provide and would probably be able to very easily go retroactive on something. But like with the homelessness category, there aren't any programs addressing, the mental health needs of the homeless in our area right now. So that just is a clear example, that would not be able to go retroactive. So essentially, unless you would just like to keep this the same, we would need an amendment to change the funding timeline. Oh, I'm sorry, I forgot. Another advantage of this funding timeline, so you have the opportunity to make this potentially just your normal cycle, so that when the current January to December program ends, this one will be going and your next round could start in July of 2026. What that would do is eliminate the need for more fund balance in your budget every year to get you through those first 4 months of the fiscal year when you don't have any money coming in, and you need to make sure that you have enough to fund everything, your normal operations, but as well as your grant program. So this just would allow you to reduce that amount in your contingency line item that is for that 4-month gap period. So it makes that a little more simple. As far as annual reporting and things like that, if our annual report is coming out at the end of our fiscal year, we're in the middle of our programming year, then we simply just report on the results of the previous programming year and then where we're at up to date in that part of the year with the current programming year. So you're always able to communicate where you're at no matter what. Otherwise, if you wanted to make things very clean, you could align your program to your fiscal year, which is March to February. So when I told the health department that that's our fiscal year, they're like, man, everybody's got their own. Like, you know, the county has December to November. You know, I still don't understand that. When I got involved, it was like, why don't we just use the calendar year? Why do we have to have a separate fiscal year? But that's just the way it is. So that's all we'd be looking for tonight. If there is any desire to change that, have that conversation. Otherwise, that's what is proposed.
So what is the board's feedback on the funding timeline?
I guess I had thought that we would have it aligned with our current funding timeline so that we have a clean cut. Otherwise, we're going to have half the money accounted for
Yeah,
and the other half. So
that's what I was thinking too, and I'm just thinking for the board, the board of trustees, when you guys propose your budget, like, how is it gonna be the most clean, so you really know what you're gonna need for the next year, right? Because you're probably not gonna do a mid-year funding, hopefully, if more agencies are applying and that sort of thing. So I would try to do whatever's most clean for that, because I think like what you just explained, even though I get it, it's like a lot. And especially, I think, to a brand-new board.
So when it comes to budgeting, essentially your programming will be allocated. So you'll already know how much money you're going to need in that time period. So when you're going for your next year's levy, you can factor in, well, we have the money already.
Whatever's been allocated, whether it was
Yeah.
round one or round two, it's like
Yeah,
the total
we
allocation.
have that in fund balance,
Okay.
you know, because that's where this is
Yeah.
coming from, is fund balance.
Okay.
So this isn't in addition to our current levy.
Mhm.
So going forward, essentially, we would know already this money is allocated, we have it in fund balance.
Okay.
So our next year, you know, we're going to open up, you know, maybe the same amount in total for grant programming, but it'll be separated from whatever's ongoing.
Okay.
Yeah.
Just like make sure you, as
Member
cleanly as you can explain it
Yeah.
and simply will be.
Member Dame, what do you think?
I mean, I think there's advantages to changing the timeline, but I think if it would be better for the Board of Trustees, then just to
Yeah,
keep
I mean,
the
it
same.
really is just, you know, whoever's presenting the mental health budget does it in a way so that, right, and that there's no confusion. And again, there's a lot of changes that are gonna be happening with the Board of Trustees, potentially with this board in the next 6 months. And so I just want to make sure y'all have enough funding to what you've allocated, right?
Yeah.
And how things come in. I mean, we're paying something from last August, right?
Mhm.
It's like, it's not super clean. And so, and I do like being able, if there was an agency that's already been doing the work and we can reimburse them, I don't have a problem with that. So I tend to lean more towards like keeping it with this, but.
Yeah, so your next year's budgeting is always going to be separated from your current year's
Yeah.
programming. So that, when it's presented, shouldn't be confusing for anyone, because
Okay.
it has nothing to do, one has nothing to do with the other,
Okay.
essentially.
Member Corns?
I don't know that I have a strong preference one way or another. I think I've seen it, a lot of the budgets or fiscal years running on that, like the July to June calendar, or the calendar year. So to me, I'm like, maybe that makes more sense changing it, but if it, like, and I don't know in regards to like when we find out about the tax levy, like what makes the most sense even there, like when we can set our budget. So if it makes more sense to keep it how it is.
I mean, yeah,
I'm-
it
I'm
really
flexible.
depends on your fund balance too. I mean, if you feel like you need, you know, then
Okay.
I don't know what to best recommend.
Okay, well, I'm,
It's a tricky one.
it is a tricky one, but I definitely, particularly Member Thrower, which pointing out with, you know, this board will be making a recommendation for the 2025 levy to the Board of Trustees, either October-ish or November-ish. And I think if we keep a grant year of 2026, keep it on the calendar year, we have an early enough view, because we'll be accepting applications at that point, and we'll see what the actual ask from the community is. And certainly, I would definitely like to see us, you know, use up this $200,000 between now and the end of the calendar year as part of the grant program. But I think in order to give the guidance that this board is charged to as far as recommending the levy amount to the township board, I think keeping it as it is, at least for now. I definitely understand, you know, fiscal years are different. You know, the state's July through June, the Fed's October through September. And we're March through February. But I think, I think the consensus has been, keep it, I I think the consensus is to keep it as it is unless I'm misrepresenting. Is that what I'm hearing?
Keep it on the calendar year.
July, January, or June, or?
So
keep
it would be
how?
July 25 to December 2025?
Yes.
Yeah,
Okay.
And if we can use it up, hey, that means we're getting the word out in the community and we're helping people, and we will budget accordingly for, and make a recommendation based on what we see coming as far as more demand.
Well, and maybe the social worker program will come into play so that if you do have leftover funds, I don't know.
Correct, and I know
I don't know.
I've talked offline about an option, what we do with that, if the social worker program is not materializing fast enough, but that's a discussion for a different time. All right, so with that information, is there any other questions or comments?
Just the timeline, so
Yeah.
we're kicking this off tomorrow then?
Are you shovel ready? is a
No,
better
no,
question.
we're
I
gonna,
just thought it said applications accepted.
well, ideally it would be going out tomorrow, but we're gonna have to still finalize
Okay.
the other documents. So ideally, we could put it out on Monday.
Okay.
okay, so you're talking about a couple of days, not weeks.
Yeah.
Okay.
Yeah.
All right.
So you would just need a motion to amend the timeline?
Okay,
So who will make that motion?
before we make a motion, can we see the timeline for the entire, I guess, cycle of when the NOFO is gonna go out? Yes, that. So everybody's clear. I mean, we're gonna be,
It's tight.
we're gonna be turning these around really quick.
Mhm.
Well, and I guess one of my concerns is with the eligible funding categories, is that too limited that we won't get the applications we're looking for in this short period of time?
Or is that just what we prefer, but anybody can?
Well, the idea being, you know, when you have it open-ended, we did that, but there's still programming that wasn't requested, so it's kind of like helps the service providers know, okay, instead of just a blank canvas, you know, they've created some limitations, and actually we've got something we can do in this category. We weren't really sure that they wanted to necessarily move in that direction.
Okay. If there's no other questions or discussion, before making a motion, Member Auger, what would you think it would be a better, what do you think amending the timeline to would be?
No, the timeline is good. I just wanted to make sure everybody saw it and kind of understood. This is gonna be happening very quickly here, so NOFO is gonna go out, applications are gonna come in, we're gonna need to be reviewing them very quickly in order to maximize the amount of, you know, money that we can
Okay.
get out to the agencies.
And that's a great reminder also, place, you know, the board approval date of June the 12th, the June the 12th meeting, that is going to be a pivotal meeting to make those decisions and approve the applications, the award amounts. So that's coming, so remember what it's like when we review these applications. And we'll definitely let, you know, members Connell and Kempf know, you know, to budget the time, because that's going to take some time. I hope we have a lot of applications. But just everybody keep that on the radar screen there. So with that, any other discussion? All right, one minor, just to point out, I don't know what will be appropriate to discuss or even to mention, but the community roundtable is scheduled for April 23rd. Maybe just a blurb or a mention with the agencies in the room, letting them know they may not even qualify for what we're targeting, but to get the word out in the community, that's another avenue to get the word out in the community, is the April 23rd roundtable. But you don't have to add it on the timeline, but it's an opportunity, that's all. Okay, if there are no other discussion or questions, please call the roll.
Was there a motion to amend?
So
Yeah,
just
we're
change the
amending it.
date to
Okay, well, I
Monday.
need to hear the motion for the amendment. What is the motion?
I move that we amend the tentative funding timeline to be July 2025 to December 31st, 2025.
Moved, is there a second? Second by Adame. I think we've already discussed this, so please call the roll on the amendment.
Dami. Auger.
Approved.
Corns.
Approved.
Thrower.
Yes, approved.
Avalar.
Approved. Now for the final vote on the motion as amended. Please call the roll.
Adame.
Yes.
Auger.
Approved.
Corns.
Approved.
Thrower.
Approved.
Avalar.
Approved. Very good job, and thank you very much. Next item is going to be discussion on website analytics.
This
Mr.
is
Auger, I
magic.
think this is your show.
gotta get two of
The
those.
talking stick, so to speak. Okay, so another thing that we have underway right now is equipping or instrumenting our website pages with analytics. The reason for doing this is to gain visibility into how many residents are actually using the website and what areas they're using, so we can determine what the uptake is. Again, going back to the survey slides where we talked about residents not knowing where to get services or how to get services, we have resources on the page, and we will be expanding those resources. So we want to be able to make sure that residents know that they're out there. And in order to know that, the analytics will give us that visibility. We're in the process of actually getting this set up right now. Wrong page. So we do have the instrumented code in. Coordinator Sanchez was updating some pages that needed to have some changes made to them to be able to uniquely identify them. And how this aligns with our overall goals, again, is kind of to improve communication with the public, making sure that the public can use the website and it's useful to them. This is just kind of a plan of where we're at. We've done some research. We're going to be using Google Analytics. We've gotten approval. There is zero cost to the township to add this capability. Right now, we've set it up initially on some test pages and made sure that it was working, and in fact, collecting the metrics. So now we have expanded it to the rest of the pages, and what we'll be in the process of doing between now and the next month will be to actually come up with the specific reports that we will use, and then generate the procedure which can be used on a monthly basis to report on this. And it will be something that will be useful not just for the mental health board, but it can also be useful for the other areas of the township website, whether it be cemetery, highway, the general government section of it. So this will give, the new board and any future boards the visibility into how many people are actually using the site, and then from that, how do you want to adjust the site to perhaps make it more useful. Let's see if I had one other site that was, again, this is more of an eye chart. I apologize. Let's see. But the idea is it's going to tell you how many users within a given period of time. You can change the scale on this from 1 day to multiple days, weeks, months. It will give you a breakdown of, are they new users, organic users? It will give you a breakdown on which pages. It will tell you where the users are actually coming from. Are they all local, or do you have people that are just kind of surfing to figure out what's going on in Dundee Township? But there are a variety of canned reports that they provide, and it'll just be a matter of settling on the ones that are going to give us, pinpoint what we're looking for, and we'll do that over the course of the next month. So with that, I will hand that back, and I don't know if there's any questions.
Questions from the board?
Very cool.
This is an excellent start. Thank you, Member Auger. Thank you, Coordinator Sanchez, for sharing. I did approve some things along the way, and managing by metrics, managing by analytics. How novel. Let's do it. Let's do that. That's the best practice that
I
we
did
all
have a
should do.
question.
Oh, question.
Ray, I forgot to ask you this earlier. It comes down to ownership, because I know you created a Gmail account for this.
Yep.
And you're able to access this. Is the idea to hand it over to township staff and to mental health board staff so that we can generate reports?
Yeah, it's not going to stay with me.
Okay. All right, yeah, because if you're on vacation, then we need to know the numbers.
No.
But the township will want to.
Yeah, part of what will happen is once I get this documented, then it will be handed over to the township supervisor, and the supervisor can then decide how to handle it. I would like to see the administrative coordinator have access so that you can easily report on our aspect of it.
Okay.
Yeah, it can be part of our monthly reports.
Yeah.
Excellent.
Yeah, I didn't want there to be a conflict with the township. It's like, hey, you have code
Yeah.
on our page and we
No,
can't even
yeah.
access it, you know?
Yeah, and
No.
I did not highlight that, but yeah, the intent is to hand it off.
Okay.
Excellent. Any other questions or comments? If not, we don't have a need for executive session. So number 11 and number 12 are scratched. We're ready to go to board discussion. Mr. Auger, I'll let you go first because you have a discussion about,
Okay,
there you go.
Just keep it.
all right. So at the last meeting, we had talked about best practices. We had also talked about at the December, what do you want to call it, ACMI membership meeting, there was a presentation given by the McHenry County Mental Health Board on, standardizing outcome measures. And what I did was spoke with Karen Frisk, set up a meeting, Member Adame, Coordinator Sanchez, and I had a meeting with them to talk about 3 topics. We talked about, the standardized outcomes. We talked a little bit about the grant software they use, Foundant, and policies. So what I will do is just kind of cover some of the highlights, and Member Adame, by all means, chime in, Coordinator Sanchez, observations you had as well. And as part of the Foundant piece, I'll try to address some of the topics that I think you were looking for. So let's go to the next page. So again, these were the attendees. The other lady that attended was Vicki Johansson, who actually administers the Foundant software. And as it said, the purpose is to consult with the McHenry County Mental Health Board on topics that could help improve our grant process. Some feedback that we got, I think when we did our last grant cycle, was that the process was too complicated. And we had some other things in terms of emails not connecting with perhaps organizations. So we were looking at ways to improve. We had a number of discussions on the metrics that we want to have service providers provide on. So this was an opportunity to learn from McHenry County what they're using to see if we can adapt it for what we would like to do going forward. Again, I gotta use the right cursor. Again, this is going to be an eye chart for people, but kind of summarize it. We went through and looked at their outcome measures. They're based on some NAMI areas, domains. They have 10 domains that they choose from. 3 of them are mandatory. All applicants have to use 8, 9, and 10. 1 through 7 are domains that are based on, whether it's mental health service, substance use, or IDDD. It also is constructed along with tools that they use to actually measure that. They use, again, McHenry County uses Foundant, and the data the metrics that they collect from the service providers actually get uploaded into Foundant, as I understood it. But one change that would make sense for our application, perhaps not this initial one for the second round, but for the 2026, is to build into our application, like they've done, the metrics that we're going to expect from them, or at least the metrics that they agree to provide, so that it's very clear up front. So that is something I will admit that the tools that they had broken out, I'm not familiar with them. Belinda, you might have familiarity to be able to comment on the type of metrics or outcomes that they would report on, but suffice it to say, there were a lot of tools that the service providers had the flexibility to choose from. So that may help in some regards. I don't know if there was anything you want to kind of add on to that?
Member Adami?
Yeah, well, to clarify to the audience, tools reference scales, really. Scales that are quite common in screening for mental health issues or even resiliency, strains. And we understand that some providers may not be able to assess for symptoms of anxiety or depression because that's not what they're focused on. So they did provide scales for like resiliency or strength-based identifiers. So I thought that was helpful because I know sometimes we're questioning, well, how can we determine the outcomes? Like, what's a skill that they're going to be using? That was a question that we've been asking. So I thought that was helpful.
Good. Mr. Sanchez, anything you want to add?
No, I don't have anything to add.
Okay. Mr. Arg, continue.
So, yeah, so they, we talked a little bit about their cycle. They bill on a monthly basis. Outcomes are reported quarterly. I guess some of the things that they're doing looked very, very useful to us. They provided us copies, text copies of their applications. 36 pages was a bit daunting, but you have to realize that what's going to get presented to the actual service provider is going to be a subset of that, because based on what they select, the various tools or scales, as Member Adame was saying, would come up for them. But it's a good model. We should look at trying to adopt what they have there. They also had, for the board members, I would say the rubric that we use sort of built in, so that it was, as you get to a particular section, we have it built in as to what we need to be looking for. So that would be helpful as well. So that was the discussion on the actual outcomes. Then we talked a little bit about the software that they use. McHenry County uses Foundant. We asked if they had used another product for reporting EMK. They don't. They're happy with Foundant. The reporting tool perhaps is not as user-friendly as the actual grant software, but that's something that can be worked around. They do provide a training segment that the person administrating this would go through. Let's see if did you include in here any of the attachments?
No.
Okay, so I'll just have to verbally go over that. So a contract for Foundant, it would be for us, a basic one would be about $4,700 a year. And the initial cost for the training is $2,500. It's a 12-week program, but it takes the coordinator through the steps of actually creating the grant within the tool itself. So there is obviously a cost component that we have to factor in for, let's just say $5,000 a year for the basic license. It's actually about $11,000 for the more medium one. So we'd have to judge very closely if we want that. To start out with, we'd probably want to consider the basic. But I think one of the downsides that we have to think about is with Foundant, we have maybe 10 applications a year. And I guess let me back up and provide a little bit more information about Foundant. So Foundant would allow us to not only have the users fill out the application online, which is beneficial for everyone. It allows the board members to actually review the applications online. It provides something called workflow management, if people are familiar with that, where as certain steps take place, they get checked off, and the next person that's responsible gets notified. So it would provide a degree of automation for us, which could be very helpful. It provides email lists that would help us ping our service provider contacts. So there's a lot of services that the tool offers. Configuration management. It will store years of past grants so that when a service provider wants to go ahead and fill out the grant for next year, they can go grab the one that they use next year, tweak a few things, and they're off to the races. So there are a considerable, it's a very feature-rich product. So that's the pros. The cons are, it's $5,000 a year. We do about 10, so far we're doing about 10 contracts a year. So that's about $500 a contract. We got to weigh if that makes sense for us. It's going to be more complex. McHenry County has a dedicated person that runs this tool. So again, we have to weigh the pros and cons of how much time is it going to require our administrative coordinator to dedicate to it. Probably it's going to be a very costly upfront process, so we got to prepare ourselves for that. My recommendation would be that we have the foundant representative that I've been in contact with come in and give us an hour presentation. Tell us a little bit about it. Allow us to ask them questions about it and perhaps overcome some of the concerns that I have in terms of the overhead of maintaining this. But it is a very good tool. It is a tool that a number of mental health boards throughout the state are using successfully. So it's very proven and worth looking into further.
Okay. Any questions or comments, or any additional comments from Member Adame Sanchez? Member
So
Throw?
McHenry County, how many applications what's their cost per application?
I'd have to take a look.
Okay, so
It's
try to find that out.
considerably more than what we
Right.
have.
So let's say their cost is $250 to $300 per application just because they have more. Everything's negotiable, so definitely have them come present. We'd love to have them. They've already have the software built.
Yep.
They're going to want to bring us on because it probably will be a long-term client, so just negotiate. That's what I love doing, but. So, yeah, that would be my advice, but it sounds great, and if providers are used to it, it could be a positive for us. It makes it easier for providers,
Yep.
and it looks
That's what-
professional. I think ours is great, but again, I think this could add.
That's why I was curious, did they speak to like an increase in applications since they implemented Found It in 2017? Or any changes there?
Yeah, that was not a question that we asked. It's something we can follow up on.
If it was more user-friendly, if it did
Yeah.
increase that, then maybe it would be worth
Yep.
us using.
Good. Okay, very good
Okay,
review. Anything
one
else?
last slide. The last topic that we, whoops, let's see, did I go backward? All right, so that's okay. Something that we've been talking about in terms of our maturity as a board is policies and procedures, documenting what we do. Again, McHenry County's board has been in existence many more years than we have.
Over 50.
So they have developed a lot of things over time. However, they have about 120 plus policies and procedures listed. They are visible to the public by going to the Policy Tech page on their website and clicking on the Visit Public site. This could be an opportunity for us to kind of jumpstart some of the things that we think are necessary to kind of set up our board as a mature board. Again, one of the things that is important to us is that as dedicated as everybody is on the board, we're not always going to be here. There's going to be new people coming in, and we need to really set up the structure and framework so that future boards can come in, pick up, from where the last board member left off, and continue, this effort. And having things documented is one way to do that. So we should be looking here for the list and evaluate ones that we think are the most important, and then look at tailoring them for our particular board's needs. So with that, I'm done.
Very good. Take the mouse from
Pass
Mr.
it back.
Sanchez. And complimenting on what you were doing with, especially the reference of Foundant being there since 2017. That's good to know because that was with a previous executive director, and then McHenry County kept, like you say, they kept things in place in spite of the executive directors changing. I think you met with McHenry County right before
Yes.
the executive director was dismissed from McHenry County, so they're looking for a new executive director, but I don't see something this foundational being replaced no matter who gets that position, so. But yeah, in case you hadn't heard, Leonette is gone, and that's a search that we'll be watching, and certainly I'm sure they're gonna have a lot of great candidates for that position. Second, I'm gonna go around the room. Any other things for board member discussion?
No, just a general plug that we need to update our onboarding page before 5/19 so that we have that all set for
Okay.
new board
That'll
member
be
coming on.
SharePoint.
Or SharePoint.
Yeah.
So noted, very good. Member Adame, anything you want to add?
Sure. I guess I would like to recommend that each member takes the time to go through the policies. I think that would be beneficial, maybe selecting 3 and coming with the next meeting and saying, like, these are my top 3 that I think we should focus on. So within the next quarter, having those completed and just getting that out of the way so we can start. I think it's always harder to initiate the process, and the McHenry County has certainly facilitated it with the information they've shared, so.
Okay. That's a very good observation. Now, it's something that I don't think was mentioned. McHenry County also has a dedicated bylaws committee, which helps do that. I know we tried to do a committee structure back in '23, and we might revisit that again, because you're right, there's a lot of policies that we want to have as our foundation. Do we need all 120?
Yeah.
Probably not.
Some
We're-
are internal, I think.
Yeah.
Definitely, but okay, and that's good to know. But thank you for that suggestion. That's a very good idea, and we can discuss how to facilitate that there, so. All right, Member Corrins? Say again?
Yeah, I was gonna say the same thing, like, do we want to all be prepared by the next meeting, looking at that list and coming up with a few that we
Perfect.
want to focus on?
Very good. Okay, I'm going to go next, and then we'll have Member Thrower go last. The couple of things that was not included in the ACMI update by Mr. Sanchez, but certainly is good to mention, is they tried something different at ACMI called a board members caucus, where some have believed that ACMI is primarily for the staff, and certainly the staff networking from across the state is a very good outcome, but there was an opportunity seen for board members. You know, we're the ones that are paid zero as we're volunteers, and we had a very good roundtable. It was great having, McHenry County Board's president and Will County, that's over 1 million population right there in the same room, both Connie Machini from McHenry and El Cortez from Will County. But we brought up certain things. Obviously, it was in the wake of what had just happened in the previous week, and of course, McHenry County, of course, is looking for a new executive director. But board members found they have a lot in common. Just getting to talk to the community, and in some places they don't have a very good relationship with their governing boards. I do believe we have a solid relationship, and it's going to continue in the future. But yet there are some boards that are learning from us. And we discussed, for instance, how we're very assertive when it comes to policy and changing the laws that need to favor us. And the legislative committee, that's the committee that I'm active with along with Mr. Sanchez. And we've definitely seen some fruit from that labor going back 2 years. And it's something that we work collaboratively with. We've worked collaboratively with the township supervisor when it came time to some very, very interesting pieces of legislation have come through, and we've sought to curtail that. I know working with the Metropolitan Township Association and with township officials of Illinois to ensure we have the cleanest policy. Because like I said, a lot of the policy ideas that are generated out of Springfield, they're well-intentioned, but they miss the mark. And an item that all mental health boards in ACMI would not even vote to support, it's clear that our lobbyists need to do work, and we've seen fruit from that. So that's why we participate with ACMI. That's why we do our best to give input, and we also learn from other member boards. Certainly, like we're learning from McHenry County, a mature board. We've learned a lot from Hanover Township, Winnebago County. We're learning, and if they can learn from us, and I think they have learned from us, it's an exchange. That's something that makes us a stronger board and stronger for our community of residents who need our services. So I just want to say it was a good tag team being down there at that, and certainly I liked a lot of the direction where ACMI is going. You gave me the authority to vote on the bylaws. I did vote to approve them. They were all approved at ACMI, and so that's been taken care of. So thank you for the opportunity to represent this board as the president, and certainly to ensure that we're putting our 2 cents into policy, not only at ACMI, but the state level. So, Member Thrower?
Okay, well, thank you. This will be my last mental health board meeting. My last day with the township will be May 16th. And so as I kind of look towards that transition, I'll turn in my resignation letter tonight so you all can move forward. But I did want to say, you know, when I started in 2021, mental health board was literally dead in the water. It was inactive. And I helped bring this team of people sitting here tonight, including Joe and Chris, together. This is the team that completed the needs assessment. This is the team that researched and worked with providers, first responders, and other local mental health boards to determine where should we start? Where is a good starting place? This is the team that collaborated with the township board to pass the very first budget and allocate the very first dollars, the very first levy for our mental health board. And we are the ones that are directly responsible, and I'm sorry if it sounds like I'm bragging, but I am, because I'm proud of you all, that got services out to nearly 1,000 residents in the past few years. And that's a very powerful thing. It's a very special thing. It's a very rare thing to be on a startup board. So thank you guys for saying yes to join this board. I think that making a positive difference in a person's life it's one of the most important jobs that you can do. So thank you for letting me be a part of that. That's all I have.
Thank you.
Thank you for your leadership.
Thank you for the leadership. So as the last item, Chair will entertain a motion to accept the resignation of Aaron Thrower.
You can't make a motion that's not on the agenda, but she can submit it.
Okay.
Just turn it in.
Oh, just be turning it in. Thank you for it's not on the agenda. And thank you. Yeah, and like I said, that pretty much says what the board president's update is going to be. On behalf of the board and on behalf of the community, thank you.
Thank you guys.
Supervisor Thrower, we wouldn't be here because of you. This mental health board wouldn't be here as we've seen the progress now, because there was a 2-year delay. We've had to make the most of it, and we have. And your leadership has been a big part of that. And like I said, all of us wouldn't be here, including Chris and Joe. And I want to thank you from the bottom of my heart, because all of you know, well, most of you know the full story of why this is an imperative for me. I've had to live this for so many years. And if we can just provide that beacon of light of hope for the residents who are impacted by mental health or substance abuse or developmental disabilities, by all means, we're going to do that. And Aaron, you started this path. The voters gave us the approval. You got us through. Now we're moving forward. Thank you so much, Aaron, for your help and your time. With that, the chair will entertain a motion to adjourn.
I'll move.
Moved by Augur. Seconded by Corrins. All in favor, please signify by saying aye.
Aye.
All opposed, same sign. Meeting's adjourned.
I guess I'm the new Chris. Yeah.